Welcome to PSLV TV channel. I am Saraswati. In our studio with us a leading senior psychologist, Annam Subramanian garu. Namaste, Dr. Garu.
Namaste, madam.
Please explain possible treatments for schizophrenia.
Yes, madam. It is very important. People have to understand what are all the possible treatments for schizophrenia.
Okay.
Generally, what happens when they observe the symptoms, they take the patient to the psychiatric doctor. That is the normal course available to people. And the psychiatric doctor asks the symptoms and he writes medicines. And he tells the people, come after 1 month, use these medicines, come back after 1 month. Again, these people go after 1 month, then the doctor will ask them, how is the behavior? He says, behavior is not reduced, it is having more aggressive behavior. Then again, he will increase the dosage of the medicines. And again, he will say, come after 1 month. Like this, every month they keep on going on. When the symptoms are, under control, they reduce the dosage. Not under control, if they are increasing, they increase the dosage. Like this, 5-6 months will pass by. Then people will ask, what doctor, 6 months over, not much progress is there. Then they will say, this schizophrenia, you have to use medicines for lifetime. That means lifelong you have to use medicines.
Okay.
So then this message is programmed into the minds of the parents or the family members of the patient. And also for the patient, brain is also programmed. We have to use lifelong medicines. But only thing people are not aware, if they are using lifelong medicines, lot of side effects will enter into the body and they will not be able to do their normal work properly. They will not be able to attend to their jobs properly because the side effects, some of them are very important. They gain a lot of weight. Okay. 15 kgs, 20 kgs weight they gain and their brain becomes dull. Okay. They experience dizziness, drowsiness. Okay. Even if they drive with this drowsiness, possibility of making accidents. Okay. They might hurt themselves and they might hurt others also. Okay. So the present possibility is only using these medicines and the doctors are saying lifelong medication he has to take. But lifelong medication if he takes, he will not be able to get married. He will not be able to do the job properly. Then I did a lot of study and research on this schizophrenia psychological issue. Then I found out, yes, even without medicines, we can solve this problem.
Yeah.
This is a very complex problem, no doubt about it. But still we can solve this problem without medicines. And then I have designed a new process for this. Okay. And the first step starts with the consultation. This consultation, we don't talk to the patient directly. First we talk to the family members in detail. Right from childhood, how was the behavior of this child or this person? Okay. What are some of the incidents which happened where he reacted in a different way? All those details we get from the parents. Then we speak to the person separately. Okay. Maybe 1 hour, maybe 2 hours, right from childhood. What are all the incidents happened? Who criticized him? Who commented him? Any violent acts happened in his life? Or any failures happened in his life? All these details I talk to them. That means we talk to the parents in detail. We talk to the person who is suffering in detail. It will take minimum 2 to 3 hours. Normally, a psychiatrist doctor takes only 10 to 15 minutes.
Yes.
They go by the symptoms. We don't go by the symptoms. Okay. We go by the complete history, what happened in his life. Okay. How the symptoms have come. What process happened. What incidents happened. I study these things in detail. Then I treat each schizophrenia person as a separate research project.
Okay.
So I go through the complete details. I design a complete new solution for him. The first step is we counsel the parents first. From now on, how they have to interact. Okay, how they should not disturb the child. Otherwise, what happens whenever the child expresses, I'm hearing the voices and all, they start fighting with the person. Oh, that is not correct. Because he is hearing, that's why he is telling. Okay, people are not there, but his brain is replaying those voices he is hearing. If the parents are arguing with him, then he will become wild. So that's why first step we give counseling to the parents. How they have to interact with this child. What to do, what not to do. All these details we explain and we will make them to write notes and they have to strictly follow these points. Okay, this is the first step. There are 2 steps here. First step is, suppose he has not used any medicine. We can make him all right within 2 months to 4 months time. Maximum 6 months.
6 months.
He has not touched medicine so far, but he is experiencing a schizophrenia problem. If they bring that person to us, within 2 to 6 months time, we will make him 100% normal. Suppose if he is already using medicines, then it takes more time because he is always under the influence of this medicine. Okay. When we are explaining taking inside, it is a bit difficult for him. So another important thing we have to understand, what I follow is called conscious brain programming. The first step is we have to bring him to the conscious level. Presently, when he is experiencing schizophrenia, he is not conscious. If he is conscious, he will understand people are not there, so voices are not there. Because he is not conscious, he is thinking that voices are coming, people are hiding somewhere, put some chip in my brain. All these things, unrealistic things he will keep on telling. So that's why what we do, we bring him to consciousness, how we explain him how this brain works, okay, how to thoughts are coming, how to control these thoughts, okay, and we have to make him to understand what is the reality, what is not reality, okay. Like this, it will go 2 months, 4 months, 6 months, like that, okay. So in this process also, we make the person to write notes on important issues. When he reads these notes regularly, slowly he will become conscious. He will try to understand, okay. We will logically guide him. Voices are not coming from anywhere outside, they are only coming from your own brain. Your brain is only replaying, okay. Then slowly he will understand. Then in our case, not only bringing him out of this psychological issue, we guide him also how to build his future now. After coming out of this, how to develop his career, how to get married, how to lead a happy family life, how to do job in an excellent way, how to interact with the people in a better way, how to perform, okay, in a team, because he has to be with the team. He cannot be all alone when he is working. So what we are doing, we are giving solution for his schizophrenia problem. We are bringing him out of the problem, and also we are giving the required guidance to build his future. I will give you some of the examples which I have treated. One lady, after marriage, after 2-3 years of marriage, she went into this schizophrenia, and she was shouting at people, and with the in-laws, with the parents, okay, with the husband, everybody she was shouting. Okay, then they realized, and they called me and they said, my daughter is doing like this. Okay, then I said, bring her to our office. No, sir, she is not coming. She is in the room. She is not allowing anybody to talk also. Then I told them, if I come also, she will not talk. No, sir, you please make a home visit. Try to convince her to talk to you slowly. So then I went there. I talked to her. Initially, she was having a lot of resistance. Slowly, I convinced her. I took the session. Slowly, like that. I went for 1 month. I took 1 month sessions. She became almost 50-60% all right. Okay. Then the second month, so I told them now she is better, so you bring her to our office. So they brought her to our office. I took 1 more month counseling. Then she became 100% all right.
Super.
She said, now, yes, I will go and stay with my husband, stay with my in-laws. I will take care of them. I am 100% normal now. Actually, her husband consulted a very famous psychiatrist, and that psychiatrist suggested medicine. So the husband told me, sir, you please suggest this medicine, otherwise she will not be able to come out. But luckily, this lady from a pharmaceutical background, she knows how these medicines will have a lot of side effects. So she said, no, I don't want to use any medicine. So without using a single tablet, with 2 months of counseling or the psychotherapy, she became totally normal. And all these days she went to the job, she is doing normally, the family, all the activities she was doing normal. Another case, this is from Western countries, she got this schizophrenia problem there. Then she has to be kept in the hospital. But she says, no, I want to go back to India and I will take treatment there. So she came back here. So initially she was not coming out of the room. So I went to their house. So we used to take the sessions one by one. I used to keep her husband also next to her because she is not listening. So some of the important points, whatever I tell, I made him to write the notes, and he will keep on reading out that notes. Like that, 4-5 sessions we have completed. She is not conscious.
Okay.
Slowly things are going inside. So after some sessions, she became normal, 50-60%. Then she came to our office. Okay. Within 4 months' time, she became 100% normal without even a single tablet.
No tablets.
No tablet. But people are telling for schizophrenia, you have to take lifelong medicines. Okay. From my research, I am telling, I have done masters in engineering, masters in management, masters in psychology. I have done a lot of research on this psychological disorder. If you have not used medicine so far, no need to use any medicines. Without medicines also, we can solve this problem. Already using medicines, yes, still you can take this psychological counseling or psychotherapy treatment. Okay, we don't tell you to stop medicines immediately. You can continue your medicines. Okay, after this counseling, during the counseling period, when he is becoming mentally strong and coming to reality, then slowly you go to your own doctor. Slowly slowly reduce your dosages, and you can come out with the medicines.
Yes.
That means treatment is available. Those who have not taken medicines, those who are taking medicines also, they can take this psychotherapy or psychological counseling treatment, and they can become 100% normal. But unfortunately, what is happening, because the parent's brain and the patient's brain is programmed, you have to take lifelong medicines. They are thinking, when we say the reality also, they are thinking, when it is not possible through medicine, how can it be possible through psychological counseling? Okay, they are having a doubt. That's why some of them, they are not coming for treatment. Only those people who knew me personally, okay, about our research work and our talents, they are coming, and they are becoming 100% normal. Once you become normal, yes, you can get married, you can go to a job, build your career. Otherwise, what happens, without taking the psychotherapy or psychological counseling, okay, using the medicines, and if you get married, it will create a lot of problems afterwards, because you will not be able to perform properly, because the psychiatric medicines create a lot of reproduction problems. He will not be able to do justice for his family life.
Yes.
Then automatically conflicts will come, then the divorces will happen. That's why I'm telling, no need to suffer from this schizophrenia problem for lifetime.
Yes.
We are giving a perfect solution. You can come out cleanly, and you can build a better future without medicines. If you are using medicines also, slowly you can come out of the medicines.
Presently, are you treating any schizophrenia cases? Please explain, doctor.
Yes, presently I'm treating one case. He's a student. He was in European countries.
Okay.
He was suffering from this problem almost 3 years there.
Oh.
He used the medicines also, but he could not come out. So after completing his course, he came back to India. Here also he was suffering from this schizophrenia. And then his mother, very highly qualified mother,
Oh.
she came to know about me. Okay, I'm treating for schizophrenia without any medicines. So she called me one day, and then I explained her the process what I am following. Okay, she got convinced, and she came for counseling first, because we give counseling for the parents first. Okay, how to take care of the child. Then I told her clearly, he needs at least a minimum 6 months counseling.
Oh.
Okay, after 6 months, slowly he will become normal. So then we started counseling for her son also. So it took 4 months for me to realize for him that voices are not coming from anywhere. They're coming only from my brain. Otherwise, he used to shout at them like anything. He was not able to sleep properly. Okay, now he realized, okay, after 4 months, he has come out of this problem. Now I'm guiding him how to build his future, how to get into a job, what type of job he has to get into, how to get married, and how to be the wife. Okay. So now almost we are going to complete 6 months time, and he is totally going to become normal. So that's why I tell people, no need to get afraid of treatment for this schizophrenia. Okay, we can treat. Even I have treated a lady 75 plus years of age also. She was suffering from schizophrenia. I went to her house, gave her this psychological counseling sessions. She became normal, and she was leading a very happy life. So what I'm telling is, no need to suffer throughout life for this schizophrenia.
Yes.
No need to take medicines throughout life for this schizophrenia. We have designed a new solution, okay, using this conscious brain programming new technique. This technique is developed by me only. This gives 100% result for any type of psychological problem. Not only schizophrenia, even bipolar, even OCD, obsessive compulsive disorder, even for depressions, different types of depressions also. We can use the same technique, and we can bring him out of this problem permanently without any medicines. If they are using medicines also, yes, still they can take counseling from us. Okay, they become psychologically, mentally strong. They can go to their own doctor, slowly reduce their medicines, and they can lead a normal life afterwards.
థ్యాంక్ యూ డాక్టర్ గారు.
Thank you, madam.
మరిన్ని ఆసక్తికరమైన కథనాల కోసం మా ఛానల్ని సబ్స్క్రైబ్ చేయండి.